This is the Good Government Show.
It's acute, unscheduled care, right? Which means veteran calls in, you call your medical center, you dial 3. That's as easy as it is to get in. It's super easy. You know, the government is supposed to be here for the people, right? So for the people, by the people, not to go all, constitutional on you, but I mean, in a sense, that's what we're here for, right? We're here to serve. That's been my true north ever since is, find where I feel like I can make a difference and try. The people that work here truly love what they do. They love the mission. Look, when you think of government, is it fast? Is it efficient? No, but it gets the job done. And VA, I think, is exceptional at that.
I think we can all agree that when it comes to veterans, making sure they're taken care of quickly and with the best care available is, well, it's what they deserve. And a new program does just that. Welcome to the Good Government Show. I'm Dave Martin. On today's episode, I talk with Josh Geiger. He's the Director of Operations for National Emergency Care at the U.S. Veterans Administration. First, help us share the message of good government by liking us and sharing us where we are on Facebook, X, Instagram, and Blue Sky. Please share our show with your friends and don't forget to review us. Let's get everyone excited about good government. Well, the VA recently rolled out a program called Telehealth Emergency Care. Basically, this allows veterans anywhere to call in and get quick access to nurses, doctors, or other medical professionals and to get fast answers to their medical questions. One of the challenges veterans face is getting the help they need. Sometimes they just don't want to ask for help. Other times the process is hard or too time-consuming or too far away. As Josh will explain, Tele-Emergency Care addresses those issues directly. As a Marine and someone who gets his care from the VA, Josh is a good person to see it from the veteran's perspective. So he knows what veterans need because, well, it's what he needs too. So coming up, Josh Geiger and the VA's Tele-Emergency Care program. What if World War I never happened? What if these three royal cousins, King George of England, Kaiser Wilhelm of Germany, and Tsar Nicholas of Russia, chose peace over pride? Good Government Show executive producer Jim Ludlow has just released a new book. The Royal Cousins is a gripping alternate history that imagines how diplomacy and courage could have stopped a war that took 22 million lives. If only they'd used the principles of good government. Download The Royal Cousins now on Kindle. It's powerful, timely, and just 99 cents. And all the proceeds support our work here on The Good Government Show. Just search The Royal Cousins on Amazon today. Welcome to the Good Government Show. I'm very happy to have with me, finally, through all our technology problems this morning, Josh Geiger of the Veterans Administration. Welcome to the show. Thanks for staying with me and thanks for being with me.
Hey, happy to be here.
Good. I wanted to just clear up something. You have lots of titles I've seen flashing back and forth. Tell me what your title is and what you're doing now.
Yeah, so technically my title is Director of Operations for the National Emergency Medicine Office, but I am on a temporary detail managing access and operations for the Chief Operating Office. So just a couple of things. A couple of things.
But as a Marine, you can handle anything. Is that correct?
Absolutely, absolutely.
And how long were you a Marine? I know you're always a Marine, but how long were you in active duty?
Active duty, 4 years.
Okay. So I'm sure that helps when you talk to vets, because I'm sure veterans like to talk to another serviceman, right?
Yeah, I mean, no doubt it helps. And I get all my care here, so, I can relate to everything going on.
Does it make a difference when they're talking to a vet?
Yeah, I think so. I mean, I do site visits to different VA medical centers, and I find that it's easier to communicate because I can just sit right down in a lobby and talk. And then it's like, we're just back, kind of shooting it back and forth at each other, making fun of each other's branches, basically what we did in the military. So definitely helps.
That's what you do in the military? You're Navy, you're nothing, you're Air Force, forget it, that kind of thing?
Marines, I got to support the Navy for the corpsmen, but, okay. If you say you're Air Force, I don't know, I'll be nice here.
Okay. So what we wanted to do is we wanted to talk about a new program you started called Emergency Telehealth. But first, let's talk about telehealth. How long has this program been around and how successful is it?
Yeah, so broadly, telehealth in VA has been around for years before I even thought of getting involved with it. Telehealth can be multiple different things. It can be primary care, it can be mental health, it can be specialty. We have kind of a bunch of different areas that do telehealth. But for tele-emergency care, we're under the umbrella of what's called VA Health Connect. VA Health Connect is the electronic technology. We started this, I want to say around like 2018, and slowly built it from a grassroots to now today where it's a national program.
And you've recently rolled out this national program of emergency telehealth.
Yeah, and this just shows the true innovation of VA and why it makes VA a great place, because February of 2023, 24, sorry, I'm losing track of my years now, we had 4 VISNs up and running, right? And between February and the end of the fiscal year, which is September 30th, we went from 4 programs to 18 programs, which means it went 4 to national in what, 7 months?
That's pretty fast.
Yeah, pretty fast. And it's just continued to excel and grow since then.
A few bugs in the system you had to work out?
Yeah, I mean, with anything, right?
Sure.
There's technology issues, trying to figure out process issues, trying to get patients to and from different areas virtually.
So tell me, this is your project. Tell me, what is emergency telehealth?
So tele-emergency care essentially is, and look, I'm not a clinician, I'm not a doctor, right? I did stay in it, Holiday Inn Express, if you guys remember that commercial one time, but I don't think that qualifies. Tele-emergency care is for those acute folks that call in. They have more than the sniffles, more than like a cut or abrasion, right? And you're going to get to a tele-emergency care doc because there's a hierarchy when you call into the nurse and they triage you, just as you would if you came into face-to-face emergency care, or when you go to primary care, you get triaged.
Right.
What's going on? Let's assess, see if this is the right place for you. So the nurse decides that, and based on the triage is when you get routed either to the contact center for, let's quote unquote, more of an urgent type care, or to the more acute sick patients to tele-emergency care. And it really helps, for especially, in urban areas, but especially for the rural veterans, because you can call in and get real-time care without having to go to an emergency department or an urgent care.
Is it the same as going to the doctor, going to see a person in person?
I don't think anything could ever replace going to see somebody in person, right?
Right.
So, I want to be careful, but it is a great program, right? And I think as technology advances, we're able to enhance more. Like we have a pilot going out west with clinical video technology. And really what that is an extension of just basically like a Zoom call, right? They have like stethoscopes and different things where they can enhance that visit.
Okay.
So it's going to continue to progress. And there may be a point in time where when you ask me that question, I could say, yeah, actually it enhances it, but we're not there yet.
Okay, but we're working towards that. So let's just start at the beginning. I know that one of the problems that you have with veterans is having veterans are reluctant, and it's very difficult to get veterans to seek help. Does this help that? And how do you deal with that?
Yeah, no, so just from my personal perspective and dealing with, my friends who are in the military, this helps because it's such a huge convenience factor, right? That's part of what this is, you have veterans that during the day they're working, they have kids, or, even folks who are retired, they don't want to drive, fight for parking, sit, wait, because if they go to that face-to-face care, typically with the issues that tele-emergency care can take care of, they're going to be less acute in the face-to-face environment, which usually indicates they're going to wait longer, right? Because your sickest of sick people are going to go face-to-face care. We're going to see, gunshot wound, chest pain, GI bleeds, whatever the case is, they're going to get seen first.
Right.
That switches the paradigm with tele-emergency care because you can call in and get seen immediately. So, of course, this changes, I think, behavior. We haven't seen or done any official studies yet, but you can just see satisfaction scores. Veterans love it.
So you are seen immediately. There's no waiting. Is that what you're saying?
No. Yeah, it's acute, unscheduled care, right? Which means veteran calls in, you call your medical center, you dial 3. That's as easy as it is to get in. It's super easy. When you call in, you're going to get a nurse. The nurse is going to say, hey, what's wrong?
There's no backlog. There's always someone available.
I'm not going to say it's like immediate like that. But it's maybe at most you're going to be waiting 2 2-3 minutes.
Okay, that's
possibly
pretty
in
impressive.
some areas, but in most cases, you're getting right through.
Okay. Are veterans tech savvy, or is there technology involved in this? Is it just as simple as making a phone call?
I'm glad you asked that question because, one, yes, it is as simple as making a phone call, right? But I want to hit on the point that most of the people that use this service are 65 years and older. So I really have a distaste for that. Well, our older veterans are not familiar with technology. They have a hard time. They've proven that that is not the case. Right. So if my mom, who's also a Marine Corps veteran, can call in and get care, and trust me when I say she is not technically savvy, I think just about anybody else can do it.
Okay. So if your mom can do it, anybody can do it. That's your point.
Exactly. Yep.
How old's mom?
Mom is 72.
And mom's a Marine?
Yes, both parents, Marine Corps dad, Marine Corps mom.
Is mom tougher than you?
Absolutely, yeah.
Has she used the service?
She has, yeah. And
did you have to walk her through it, or did she just use it? Did she just pick it up and you gave her a little instruction, which is always nice when you tell your mother how to do something technology-wise? But was she no problem?
She called me up and she said, hey, I got this new service, and I called in and got care. I didn't have to drive because she lives an hour away. And she lives in Maine. So, she hates driving in the winter, or she hates driving when it's dark out. And it's a funny story because she always has a hard time explaining what I do in the VA. And I got to tell her, like, Mom, you know how you're always asking what I do? And I said, that program is something I helped create. So I got to tell her.
She just used the program without knowing that it was your program?
Yep.
How are you getting the word out to veterans about this?
So that's pretty much handled at the facility level, right? They do a lot of their own media and communications, but there's a strategic front to it from, the national perspective. Obviously, we're going to put out standardized, information, text, literature, and then the facilities, the public affairs officers, they spread that through town halls, social media, you name it.
So one of your jobs here is you're responsible for emergency care for the VA. Where did this idea come from? How'd you get this?
Yeah, so point of clarity is Dr. Neil Patel is the executive director. He's an emergency medicine doc and rightfully in charge of emergency care. I handle the operations part of it.
Okay.
Definitely don't want me running the helm there. But
all right.
So this actually was born out of my own care journey. I was at the time a traveling veteran, and realized that guys like me who have injuries from the military, chronic issues, at that point in time in 2017, my alternative was to go get an appointment with my primary care doc, or go to the community ER, urgent care, or go to the VA ER or urgent care. And I was like, I knew enough at that time, like, I don't have to sit here for this. Like, somebody could see me over a phone. And that's basically where the concept grew. And we had our first pilot way back in the day in New Orleans. And just from there, especially, it kicked off out west and just, grew like wildfire.
Is this just a phone call, or is it a video call, or can it be either one?
Either one.
Okay. So somebody could say, like, lift up their, pull their shirt back on their collar and go, what's this on my neck? Yeah,
we actually have stories of veterans, 75 plus, where they had lacerations, from a fall on their head, right? And they called in, and they were able to help the veteran, take care of the wound, redo the things that they needed to do, so he didn't have to come back into the emergency department just to get that cleaned up. They were able to do it over video.
They said, go get a washcloth, wipe it down.
Walked them through it.
Put a Band-Aid on.
There's even examples of cancer being diagnosed through Tele-Emergency Care, sending the veterans for test results, looking at pictures, and being able to communicate different things to them like that. I mean, that's pretty powerful.
Sure. This is not the best way to treat cancer, I think we could agree, but it's a good way to sort of get the ball rolling, right?
Yeah, it's a front door,
to start your care.
So it initiates the care, yeah.
And I understand that this is sort of an outgrowth of what was called the PAC Act, the Promise to Address Comprehensive Toxins, which was started off with the burn pits from Iraq, and that's how all this sort of got pushed forward. Is that right?
Well, I mean, not 100%, right? So the PAC Act definitely helped with all of our innovations and rollout, but this started before that. It started pre-pandemic. So you look at all of the things that happened post. They've just definitely enhanced the path that we were naturally on and sped it up, I think, quite a bit.
So how long did it take to start this program? I mean, was this actually created, and now that you're rolled out, what was the time period between creation and full national support?
I would say between creation and full national support, I'm going to say about 2 years.
Okay. So hopefully along the way, they worked out a few little kinks and problems. Yeah.
Yeah. I mean, I can remember the day that, we started this, and from the day of the conversation with facility and network leaders, it was in production in 30 days, right?
Okay.
We tested it for several months, and then it just grew facility by facility until it became a VISN program. And along the way, technologies changed, processes have changed, policies have changed, and all of those have just helped, move this along, I think, much better than we could have when we initially started.
What are you happiest about the way it's worked?
The convenience of it. I mean, just, honestly, what I'm happiest about is that, a guy like me can come up with an idea and it turns into a national program. Because who am I, right? I'm just a guy that gets my care at VA. And the fact that I can say, hey, I have this idea and people buy into it, to me, that makes me, we call it bleed blue, right? We bleed the VA mission. I mean, and there's a history of this in VA, like, what is it? The patch that was created at VA. I mean, so you can go back and you can find. So to be a part of that history is what kind of geeks me out. Other than the fact that, it's easy to use and people love it, right? But just being a part of that history is so cool to me.
And that's what public service is all about, isn't it?
Yeah, absolutely.
We've all seen the headlines in the papers about budget cuts federally to, across the nation, especially to the VA. How do you assure veterans that this program is going to last?
Emergency medicine is the front door of VA, right? So I think the benefit that we have is we have emergency medicine docs who are providing the care to veterans. So this is just another shift for them where they already would have been there. And you can see, the veteran's voice really carries through here. So the satisfaction, it really just amplifies the fact that this program is loved. It's strong, and it just continues to progress and grow and move forward.
So we're going to be here a while.
I believe so, yeah.
Okay. All right. We're going to get your thoughts on government, and that's going to come up after this. The Good Government Show is sponsored by Our. That's OUR for Our Community. Get involved. We hear that all the time from government leaders. Our co-brands with your government's name and logo. Your staff and the people you serve are connected and part of your community. From any device, your members provide reliable data and meaningful feedback. Ask a question like, do we want more parkland or better homeless services? More engaged conversations come through the Our app. Visit Ourco, that's OURCO.com, and book a demonstration.
These are difficult times, and if you believe in justice, progress, and democracy, the news you read and listen to can be pretty depressing. And that's why there's a new podcast called Good News for Lefties and America. Every day it features positive news stories for progressive listeners, because no matter how disturbing the headlines might be, there's always hope we can build on for a better tomorrow. Good News for Lefties and America. Listen on this platform at goodnewsforlefties.com or wherever podcasts are heard.
All right. This is our Good Government Show questionnaire. You are in government for a long time, either active duty Marine or here with the Veterans Administration. Define good government. What is good government to you?
Good government. Wow, that's a hard question. No, good.
These are the easy ones. Come on.
Government is supposed to be here for the people, right? So for the people, by the people. Not to go all constitutional on you, but I mean, in a sense, that's what we're here for, right? We're here to serve, and I think that if we create spaces where people can do that, they can elevate ideas to the top that ultimately get implemented to the front line to serve people. To me, that's good government. Is it functioning? It's good.
So, there's the Veterans Administration, especially VA hospitals. I mean, you sort of hit on this a little bit before. There are long waits, and there have been long waits at times. What can people do if they don't feel like the VA is working right for them?
Well, that's the thing is VA care is community care, right? It's all one and the same. So thankfully, as a veteran, we have choices, right? We have the ability to seek community care where we don't have VA care, and in some instances that's vice versa. There's no community care, there's VA care. That's a luxury, I think, that we have as veterans in this country to be able to get those services, right? So we have the ability to seek out and find where there is access and go get that care.
So you mentioned before, both your parents are Marines. You're a Marine. What made you want to stay in public service and not, get out and do something different? Why do you stay?
It all started. I came out of the military. I had to get surgery, and I didn't have a great experience. Went in to complain, and the guy I went to complain to, and I tell this story for relevance because it leads to why I'm here, right? But the guy I went to complain to was a chief corpsman, right? And as I kind of alluded to before, Marines and corpsmen, we have a long history of, they take care of us, right? They're our docs. And he simply said, hey, you're not going to fix it from out there, Marine. And so, checking my ego at that point, I was like, okay. Challenge accepted. And that's
he was messing with the wrong Marine, wasn't he?
Yeah, exactly. That was that's been my true north ever since is, find where I feel like I can make a difference and try, and if I'm not trying, then, I'm of no use to people who are getting the care here if I'm not trying to make it better.
Is this where you always thought you'd be, is doing something in public service, or did you think you were going to be a career Marine?
I thought I was going to be a career Marine till I got hurt. Had a steel plate on my shoulder. I couldn't lift my arm up. So they were like, hey, you can't use you right now. And, so I had, I got out of the Marines and kind of bounced around, had no clue what I was going to do, and then found my way into industrial and organizational psychology. Really fell in love with that. Fell in love with the science of understanding people and behaviors, and realized that I could really apply it here in VA. Did I ever see myself in the position that I'm in now? No. But do I love it? Yes, because I feel like I can have the most influence to make the most good happen.
What would you like people to know about the Veterans Administration?
That the people that work here truly, truly love what they do. They love the mission. There isn't one person, and I've been to I think 60 VAs, and in over 20 years, I've never been to a place where I haven't met somebody who isn't truly in love with the mission and truly loves taking care of veterans, no matter at what level of the organization you're in. And I think that's the heartbeat of what makes us great, is that the people just love being here and are truly dedicated.
What's the best part of your job?
Well, it's pretty cool being able to talk to you. No. But,
well, thank you.
No, the best part of my job is I get to do things like Tele-Emergency Care. I got to work on creating a whole new policy for urgent care, where we're expanding urgent care in rural areas. Never been done before. I get to work on stuff like that. I get to work with people who have these great ideas, and I get to elevate them and bring them forward to try and make positive change. Right. So who wouldn't like that?
Have you ever thought about leaving the VA and going to work for a private hospital and doubling your salary?
No. Well, look, has a thought creeped in here and there? Yeah, of course. Who doesn't get interested from some money every now and again? But no, I wouldn't be able to do what I do on the outside. It would be more focused on, measures and profit generation than, what I'm able to do here, which is focus simply on care. And, maybe there'll be a day where, I'm not here anymore, but it's not today, and it's not in the foreseeable future. I truly love what I do. So
you run operations for for Tele-Emergency Care nationwide. Something must keep you up at night. What is it?
Man.
Do you want to start the list now?
Honestly, so I have an approach where, I come here and I remove feelings, which is easier said than done. So I try to leave work at work, because I do have, 3 kids, a wife, and I got to make sure that I give them the right time and attention. But what keeps me up at night is, do we have processes and programs in place for when things break? And when things break and there's nothing there to fix it in the appropriate amount of time, that's really what keeps me up at night. So I'm always trying to make sure we have redundancies and processes in place, because I've seen too many times where we didn't think of something which ultimately impacted or delayed, care or an operation from occurring. And so that's what keeps me up at night, is the unknown, the unintended consequences that ultimately at some point in time will break or will raise to the surface. And we didn't think it through, or we didn't bring the right stakeholder in. You're going to get me going on a soapbox here, but that's what keeps me up.
All right, I'm going to switch the topic then. Usually I ask this of elected politicians, mayors, and governors and senators, etc. I ask them what their favorite local dish is in their neighborhood, but I'm going to ask you a twist on that. What's the best meal you had in the military?
The best meal I had in the military was,
And where was it?
It was actually Paris Island right after the Crucible. And I think sleep deprivation and lack of food may have contributed to this.
Okay.
But it was the one time the Marine Corps went all out and we basically had Air Force level food.
Okay.
They called it the Warriors Breakfast, and we could eat whatever we wanted, and it was delicious and great. But that definitely by far is probably the best dinner I've had in the Marine Corps.
Just because you were done and I can have anything I want, I don't have to worry for the next 24 hours. All right.
Yeah. It was all right. Yeah, for sure.
So a wife, good on the Marines for serving you. I did not expect Paris Island to have the best food in the Marines, but hey, listen, I'm glad you got a good meal. A wife and 3 kids. What do you do for fun?
So I like to write, play music. We love to travel, love the beach. So anytime I get a chance to sort of, do that stuff. I also have a little girl named Pepper. She's my dog. She basically tolerates everybody else. And so, just spending time with them, doing different things, watching movies, referencing, pop culture, just hanging out, having a good time.
What's the most impactful thing that you think that the VA does overall? What's something that people might not know about the VA that they do? I guess that's sort of 2 questions.
Yeah, no, you're asking me all these questions where I could go on for hours. But what does the VA do? I think just the adaptability and change. I don't think, because when you think of government, is it fast? Is it efficient? No, but it gets the job done. And VA, I think, is exceptional at that, where it may not move at the pace of the private sector, but we adapt and we change so quickly, and it's based on the voice of the veteran. And I think that maybe sometimes that isn't truly seen, where we are listening, we do hear you, right? And many of the people that work here also get their care here, right? So we are in places where we're advocating for positive change when things are broken or need to change, right? And I think we do that very well, fluidly, for such a large organization. And that probably gets missed sometimes.
This is the Good Government Show, and we always like to bring it back to good government. Tell me about some good government project that you've been involved with at the VA that would impress folks.
Yeah, outside of Tele-Emergency Care, it's completely revamping urgent care. And we, since we've revamped it, we've expanded it to clinics in Hawaii. I think right now.
Did you have to go? You better go check that out. Have you had a chance to look at the office in Hawaii and make sure it's up to speed?
It's a running joke where, hey, we need to go down there and check this place out. But no, they're pretty good on their own. They're smart people down there, and they know what they're doing. So I'm going to leave them alone. But, all right. I think one of the things that, being in this temporary role that I'm in right now over access and operations, I get to see things at a different level of the organization. And so one of the things that I'm really proud about working on is just aligning and organizing how we approach access initiatives and how we are working hard to get on the same page, remove redundancies, that are, or remove duplication and keep necessary redundancies where they're needed. But, Tele-Emergency Care and expansion of urgent care are definitely my 2 icing on the cakes of my career, the things that I'm most proud of.
Josh Geiger, Tele-Emergency Care, the U.S. Veterans Administration, an excellent discussion about being in public service and taking good care of our veterans. So thanks for being a veteran, and thanks for taking care of your friends and your colleagues and your mates. So well done. Thank you.
Appreciate it. Thanks for having me.
After you get done with this episode, hear more good government stories with our friends at How to Really Run a City. Former mayors Kasim Reed of Atlanta and Michael Nutter of Philadelphia, and their co-host, journalist and author Larry Platt, talk with guests and other mayors about how to really get stuff done in cities around the nation. Check them out where you're listening now or through their nonprofit news site, thephiladelphiacitizen.org/podcasts. Here's something I didn't consider until I talked with Josh Geiger. The men and women of the VA are made up in a large percentage of veterans. So when you think about the people who work for the VA and provide their care, really, they're helping themselves and their fellow vets. Like Josh, they understand what vets are going through and they know what they need. That's good government working for everyone. As we continue to hear about changes and cuts at the federal level, Tele-Emergency Care is working. So even in the face of these changes, there's still good government out there and serving the people that need it. And that is good government. And the best meal at Parris Island, the Marine Corps Training Center? Surprising. But I suspect that after you finish Marine Corps training, it probably is the best meal ever. Well, that's our show. Thanks for listening. Please like us and share us with your friends and review us right here where you're listening. And check out our website, goodgovernmentshow.com, for extras. Help us keep telling stories of good government in action everywhere. Join us again for another episode right here. I'm Dave Martin, and this is The Good Government Show. The Good Government Show is a Valley Park production. Jim Ludlow, Dave Martin, that's me, and David Snyder are the executive producers. Our show is edited and produced by Jason Stershic. Please subscribe, then share us, and like us and review us. That's the best way to make sure we're able to keep telling these stories of our government working for all of us. Then listen to the next episode of The Good Government Show.